So my name's Jonathan and I'm a consultant at the hospice. Before COVID, I was based mainly in the community, but doing a bit of work in the hospital and in the inpatient unit. During COVID, I was trying to be as many places as possible, but I guess mainly based in the inpatient unit. So I guess thinking about the challenges of COVID, our most junior doctors were taken back to the hospital where they were needed for acute medicine. And all of the remaining doctors at some point developed symptoms or tested positive for COVID, so are off for varying amounts of time. So at times there were one or two doctors doing the work where we would normally have 6, 7 or 8 doctors. I think my longest run was probably doing sort of 24 out of 26 days on the inpatient unit. And that was really tiring and felt quite relentless. At the end of that time, I had an enforced week off because I developed symptoms and tested positive for COVID. Luckily, my symptoms were quite mild, and I was able to return after a week. I guess the next challenge that we had was morale in the hospice. So by this time, the atmosphere in the inpatient unit felt quite tense. I think by now, everyone knew someone who had been very unwell or died from COVID. But I was really impressed actually how everyone from nurses, healthcare assistants, housekeeping, kitchen staff, all pulled together, pushed through and did their jobs so well in such challenging circumstances. I guess one of the positives for me being on the IPU so much at that time was it gave me time to witness up close some of the care that our patients were getting. So, for example, we had a lot of very sick young patients at the time with big families in some cases, and looking after those patients, explaining to people that we had to limit visitation was so tough. And seeing how skillful and compassionate the nurses can be in such sad and difficult circumstances was a real privilege, and made me very proud working here actually. All in all, it's been a tough few months and a steep learning curve for my first 9 months as a consultant. But I've taken a lot of positives away from the situation as well. Firstly, that so much of the care that we provide here is truly outstanding, and I couldn't be prouder of that. And secondly, that I guess realising how much support I've got around me, whether it be nurses on the unit, staff at the hospital, the senior leadership team, or our GP colleagues, all ready to step in and help when we need them. And that makes me confident that although the next few months aren't going to be easy, I think we're in a good place to cope with whatever is thrown at us at that time.